Hello, everyone. It is me again. My name is Brenda Hankra. I'm the CEO and founder of My Well Self, and we're committed to empowering clients on their wellness journey by educating them on and introducing them to personalized wellness treatment with our one-to-one support feature. But we, again, as I always say, not here to talk about me. We're here to continue with our series of wellness frame of mind, we call it, to introduce the wonderful wellness providers that are out there. And today I'm excited to speak about I always get the word wrong.
You're going to
Homeopathy.
get it right. Homeopathy.
Homeopathy. You know
Homeopathy.
how sometimes people just can't say a word? Before it used to be
I
Tylenol.
do. I
Yes,
do.
it's just the
I do.
one
I have
word.
several of them, Brenda. I'm not going to say them
So
on
don't
here.
don't feel shy to correct me if I don't say it right.
It's perfect. Homeopathy.
Homeopathy. There we go. That's going to be my new Tylenol word that I can't pronounce. Really excited to have Christina Barrett, who is the owner of Healing by Caring, which is a clinic based right close to Orangeville, which is north of Toronto. She accepts virtual consultations as well as in person consultations. And we're going to speak to her about everything about homeopathy, her journey, and yes, I got it right.
You got that totally right.
Her journey and why you should reach out to someone like her in terms of homeopathy. So, thank you, Christina. I'm really excited to have you here. I'm personally very excited to learn more about you and the profession that you offer because I think more people need to be aware of people like you. Okay, I really, really, really do. So, we'll start off by introducing yourself. Please introduce yourself to the audience.
Oh, thank you, Brenda. First and foremost, thank you so much. We always get excited in the world of homeopathy when people
Mm.
express interest. So thank you so much for making the time to have me on today. My name, as Brenda said, is Christina Barrett. My professional title is Registered Ontario Homeopath. I do practice in Hockley Valley, Ontario, which nobody's going to know where that is. So think Orangeville. And if you still don't know where that is, we're north of Toronto. And my tagline for my business is healing by caring, because we really do believe that healthcare should be personalized. And so if we're not caring about your health, the healing isn't happening. So that gives you a little bit of background on me, Brenda.
That's amazing. Great introduction. And so what was your journey to becoming a homeopath? What led you into this space?
Well, so I can honestly tell you, I grew up with homeopathy. My mother, my father were very interested in it. But for me, I really, when I was young, wanted to be a doctor all the way through. You know, every little girl, I think, I don't know any little girl who doesn't start out wanting to be a vet. Then you realize you have to actually, put needles in the animals and stuff, and that goes away. So I decided then I wanted to be a doctor. Around the age of 12 years old, I was an asthmatic child. I had an incident where we had to go to the hospital because I was having severe breathing issues. And bless the people in that hospital. I must have been there for 2 or 3 or 4 hours. I know it was very late at night before we got out of there after numerous tests. And I mean, they tried everything. And they finally came back and said to my mother, unfortunately, she has viral pneumonia. Until it becomes more complicated, until it becomes full blown pneumonia, or the beginnings of viral pneumonia, until it becomes full blown, there's nothing we can do. We can't give her anything until it becomes a lot worse. And my poor mother looked, and I am Irish mother, and was like, "You got to be kidding me! I'm taking my child home to get worse."
Yeah,
So stubborn lady that she was, and believe me, this is not a fault of the practitioner. The practitioners did everything they had in their toolbox.
right.
Okay. So, but my mother was a stubborn Irish lady and went, you know what? I'm sorry, I can't accept that as an answer. So she called at 2 o'clock in the morning. She called our homeopath at the time and said, here's what's going on. And he was very brilliant. He said, I want you to put her on this homeopathic, bundle her up really warm, do the following things, and I want you to call me as soon as she wakes up in the morning. So took the homeopathic recommendation he gave me, bundled up. By the time I woke up in the morning, all breathing issues were gone. It
Wow.
was like I had a bad cold. And so that for me at that moment it was not just that the medicine worked, which was fantastic. It was the care and the determination of the practitioner that, okay, we'd heard there was nothing you can do. Now we're going to try this. And that's what I think I love about the profession the most. And when you go into this space is that there's always an answer. You
Right.
just have to keep reaching out until you find the person who has the answer for you. So
Wow.
that's how I got into homeopathy, Brenda.
That's a wonderful story, and thanks for sharing that personal moment. I think everybody who is inspired to do something, it's triggered from a pain or some type of
Absolutely.
experience. Yeah, so thanks for sharing that with us. And so now that you've recognized that this is kind of your journey, what kind of training did you have to do to get to this point in your life?
So I would tell you my training, I've been in the industry for a very long time now. I've been in for 19 years. So
Wow,
I did a 7-year program with a homeopath one-on-one.
wow.
I specialized with him. So I did 7 years of clinical training with him. Currently, though, if you want to be a homeopath, it's a 3 to 4 year accredited training program at a homeopathic college or school. And then the training would include anatomy, pathology,
Mhm.
intense advanced homeopathic studies, and of course, clinical experience. Back when I was doing this, nobody was doing this. So I did a 7-year one-on-one program with a homeopath who had been practicing for over 40 years. He was in his 80s when I
Wow.
started working with him. And then after that, we did go into regulation. So there is regulatory that comes in after the fact. So generally, your homeopath should have, like, there seems to be a misconception that we take a 6-month mail order course and that's when you become a homeopath. I
No,
specialized, so it was a 7-year program.
right.
Just a regulated homeopath has a 3 to 4 year very intensive program.
Okay, so yeah, yeah, I'm glad that you said that it's not an online course that you take for a day and then boom, stamp, you
No.
get something. No, you guys are well trained and yeah, we want to highlight that. So that's great. Thanks for explaining that. And you mentioned a little bit about regulations. Are
Mm.
homeopaths regulated? If you could explain
They
that, that would be great.
They absolutely are in the province of Ontario. We are regulated. So we're regulated under the College of Homeopaths in Ontario. It's our regulating body.
Mhm.
And you do need to be assessed and assigned to practice in Ontario as a regulated Ontario homeopath.
Right.
The College of Homeopaths of Ontario was established to allow some self-regulation of homeopathy
Mhm.
within the profession, and the framework is regulated under the Health Professionals Act of 1991. So we're actually regulated in a very similar way to your doctors, nurses. We're under the Regulated Health Professionals Act.
Right.
And then the Homeopathic Act was added in addition in 2007. So a lot of people don't realize not only are we regulated, but we're very heavily regulated. So
Great.
in order to call yourself a homeopath in Ontario, you are very carefully monitored, and we work very carefully and closely with the college.
Okay, great. Now, this is a bit of a sidetrack. In terms of other provinces, are they on the same kind of, I don't want to use the word level, but are they also regulated in other
Not at this
provinces?
time.
Okay,
Ontario is the only province within the country that regulates their homeopaths at this time.
okay,
So within other provinces, if you are outside of Ontario, they aren't regulated. So you really want to carefully investigate how long was their schooling and so on and so forth.
okay, great. Thanks for that tip there. Now let's get back to you. Got
Yes,
a little bit
ma'am.
of a background. So when would someone want to come and see a homeopath? They're sitting there, they're going through these issues. At what point should someone say, you know what, I need to sort out and seek out someone like you? At what point would they do that?
I would say a homeopath will always tell you always, like
Yeah.
there's almost any reason you could. When do we usually see patients?
Yes.
Usually we get patients, unfortunately, when people have kind of gone, okay, I don't know what else to do.
Got it.
A good number of my referrals come from naturopaths that have tried all of their protocols and all of their systems, and they're like, you know what, I just haven't been able to make headway with this patient. So the question then becomes why? Why is that when we get referrals? Because homeopathy, as opposed to some of the other healthcare professions, it's a little bit different. What we're doing as a homeopath is not treating an illness. We're treating you as a whole person. It's
Right.
very, very specialized and very particular to you. So a lot of people will ask, like, do you treat arthritis? Do you treat sleep deprivation? Or sleep issues? Do you treat anxiety? The short answer is no, because we're not treating the disease, we're treating the person. And the
Right.
reason the naturopath sends this person to a homeopath is that we have many beautiful genetic predispositions.
Right.
And we have some genetic, and I don't care who you are, everybody has a genetic predisposition where there is a weak link in the chain.
Correct.
So, what we believe as a homeopath is if we reinforce your constitution, who you are mentally, physically, and emotionally overall, we reinforce those weak links so they're less likely to give when pressure is applied. So, naturopaths, herbalists will sometimes refer to a homeopath because they're doing all the supplementation, which is literally doing what it sounds like, supplementing for something your body's not doing.
Right.
And they'll instead send them to reinforce that constitution. So now when we go back to a naturopath, all of those things start to work a little bit better because overall their system is running better.
Okay, great. So what I heard was that homeopaths really make sure the wheel is turning well without any clinks in the turn, so to
Exactly.
speak.
Basically, what we're making sure is that the frame is there because
Yes.
we can keep putting patches on stuff to
Yes.
get it working. But if you don't have a good constitution to start with,
Yeah.
that's why some people can go under massive amounts of stress and it doesn't seem to affect them. And other people, as soon as something happens, they get knocked off their horse. It's because constitutionally they might just need a little bit more reinforcement.
That's great. Thank you for explaining that. I have a good visual right now. So
Oh,
you kind of
good.
talked about a little bit about, when people come to see you, and you kind of hit on how you're different, compared to other provider types out there. But can you just elaborate maybe a little bit more on that? How do homeopaths treat their patients a little differently? And again, you mentioned that, but love to hear more, and how your
Absolutely.
approach differs from other health providers out there.
So I would say the biggest thing is that when we bring them in for assessment, we're not just, we absolutely want to hear about the symptoms that are bothering you. Of
Yeah,
course, that's relevant. Of course, that's important, but it's not the only symptoms we're going to be asking about. And this is where it can get confusing for patients who have not seen a homeopath before. You're coming to me because you have psoriasis, and I'm asking about your sleep, your hormones, your
right,
bowel movement. They're like, what does this have to do with my psoriasis issue? What we really believe is that yes, your symptoms are trying to tell us they're not actually bad. We feel like they're bad because they're inconveniencing us. They're
right.
inconveniencing us because your body's actually trying to tell you where an imbalance is happening. And it's gotten to the point you haven't addressed the imbalance yet. So it's going to start to make it inconvenient. So you have to address the imbalance. So
Wow.
we take the symptoms that you're telling us about, and then we also take a look at symptoms that because you've had it your whole life, you may not even realize that it could be a sign of an imbalance. So we are really looking at you as a whole person, mentally, physically, emotionally, and then using those key symptoms that you came in with. The things that are really bothering you are the flashing red signal telling us that something is really off. Finding a constitutional remedy that not only addresses the symptoms you're talking about now, but possibly symptoms you've had. Generally, most people, it's from childhood
Wow.
that have just escalated into the problem that you're dealing with now. Once we find that constitutional remedy, the interesting thing is you'll find we all take like copious amounts of notes. We spend most of the time writing while we're talking to you. We're assessing how you look, how you speak, how you're responding.
Right.
Um, then when we go to our next appointment, it's very common for homeopaths to sit down with a patient and go, okay, so how are you doing since the last appointment? And they go, nothing's really changed. And
Mm,
you go, okay, all right. So let's sit down and go through our notes on what we talked about. So you're still getting up 3 times a night to pee.
right.
Well, no, that's kind of gone away. So
Right.
that rash on your leg, it's still getting worse. It's so gentle and natural in how it reacts that you don't even realize that these little
It's happening.
annoyances have gone. You just suddenly know that they're not there anymore when it's brought to the person's attention. So it's when we say holistic, I truly believe homeopathy is one of the most holistic
Right.
um, practices out there because it really is balancing you as a whole person. And again, I can't reiterate enough. We're treating you, we're bringing out your best self, we're making you the best you can be. We're not treating a disease.
Okay, great. You just kind of got me to think about how our body talks to us, right?
Mhm.
And we take for granted that symptoms are like signals. It's like our body's saying something's up, but I think this world, sometimes you forget to listen to those signals, right?
We've been trained not to. We've been
Yeah,
trained to try and shut it down and just push our way through. And let me tell you, Brenda, there are times that has to happen. There
yeah.
are times that you can't just stop and deal with it. But when it gets louder and louder, that's your
Mm.
body's way of trying to tell you, this is as far as I can go, and it's now time to take care of us. It's time to
But
take care of us.
yeah, that's
Yeah.
a lovely analogy. Thanks for that's visuals in my head right now. I love this question because I'd love people to give the opportunity to shut down some myths. So
Mm.
about their profession. So what are some myths that you want to dispel about homeopaths? And I'm actually quite curious to hear what you have to say.
Well, I think my biggest one, and the one that tends to bother me the most, is there's absolutely no scientific data that proves homeopathy does anything.
Right.
While I will 100% agree, there is not enough scientific data to show what homeopathy does and how it works. It's absolutely untrue that there is no scientific data that shows homeopathy works. There is not enough money being put into the research that is required to show how homeopathy works. And having come through natural for 20 years, many of the things we're using now, probiotics being one of them. I remember when that was not, there was just not enough research to show
Right.
how it works. Now we have copious amount of research because the right people got in the right financial place and started backing it. Now, what I will say is it's very exciting having traveled through homeopathy for 20 years from the days when it was voodoo medicine to where we are today, where it was completely ridiculous.
Voodoo
Which
medicine, no.
yeah.
Oh God.
Well, and even, but that's, I get it. If the science isn't there, you know, it's very hard to say, okay, it's working. But there's a couple other pieces to that. But the bottom line is the science is coming.
Right.
And as they look into nanotechnology, as we're able to see those particles for completely different reasons, pharma, which I know people have problems with, but they do have the money and the funding, and they're doing amazing research on nanotechnology right now and nanoparticles. As we get closer to that and they're developing these sciences, I truly believe in my lifetime there'll be more and more science to back homeopathy because we'll be able to see. It's like many other aspects of life. The world was flat, probiotics didn't work,
Right.
we just didn't have the science to see it yet. So I think that's the biggest misnomer or myth I'd like to dispel about homeopathics. We have a lot of anecdotal evidence, and while I totally agree that's not scientific evidence, it also can't be completely dismissed.
Correct. Okay, good for that. I just back to the probiotics. My dog even has probiotics right now.
Oh yeah.
Yeah,
Yeah, everybody. No, I
everybody
remember
has it.
when probiotics came out and everybody was turning around and everybody was laughing at the health food crazy people who were
Right.
using this is what I'm not saying everything that goes through health food is 100% either, but what I'm saying is homeopathy has been practiced for hundreds of years.
Yeah.
In Europe, it is very well established.
Mm,
And I agree that we can't see it yet. I do not agree that means it's not there.
correct. Great. Wonderful. Okay, so what is a so if someone were to seek you out, they're seeing you, what does a typical session look like with you?
So the first step would be you will get and any homeopath should send you a very comprehensive intake form,
Okay.
which I always say if you're going to a medical practitioner's office, paperwork is just part of the fun. Like you can't go and not. It will go into your eating habits, your sleeping habits, and just about every bodily function that you have. It seems a little bit much,
Right.
but that gives us a good headway that I will research before I see you as a patient. Then your first appointment will be an hour to an hour and a half. During that time, we're going to go through what your current complaints are, when they started, when was the last time you felt healthy is a big one that I bring up with my patients because a lot of
Right.
times they're there for that one complaint, but if you go back, they actually haven't felt healthy for a very long time. It's just escalated to the point that now they're doing something about it.
Okay.
Following that, generally, I will not prescribe, maybe I will prescribe, depending on how bad the symptoms are, a couple of things to help them feel a little better while I work on their case. During that time, I've spent as little as 2 hours and as much as 40 hours researching a client's individual assessment and matching them up with what we call a constitutional remedy. This
Okay.
remedy, which is made from very minute doses of plants, trees, animals, very, very small micro doses, helps to stimulate their own body into doing what it's supposed to do. So homeopathy works on the premise of like curing like. An example would be a fever. We believe the fever is there to help kill a bacteria, to help kill a virus, to help. So we would, if you have a consistent fever, we would give you something that might stimulate the fever a little bit. We're not talking send you to the
Okay.
hospital. We're talking a couple of degrees,
Right.
which will then kill whatever's happening because maybe your body's just not quite able to get there on its own. And
Right.
now it's killed whatever's happened and the fever will go down naturally because your body's done what it needs to do. That's an acute use of homeopathy. Um, a constitutional remedy will help to match up with all of the unbalanced things we've discovered in your intake and help to balance out as many of them as possible. So you won't just find the symptoms you initially came to a homeopath with go away. You
Right.
may find that you didn't realize you weren't sleeping properly. You didn't realize that you were going to the bathroom too often. You didn't realize, and all of a sudden those things will balance out as well. So after that, we put you on the constitutional remedy. And generally that works very, very quickly when we hit on the right one. Sometimes it takes us a couple tries because they can be very similar,
Right.
but when we hit on the right one, it's usually very, very effective.
You just said, man, you kind of got my head spinning about the fever. Yeah, I think we were taught to suppress it, right? It really is your body.
Absolutely.
It really is your body kind of burning off that,
It can be.
yeah.
It can be, right? I mean, this is what I'm saying with we've been taught general, and I do not want to dismiss
No, no,
mainstream medical.
as you
There
should.
are times where if you
Absolutely.
have a fever and it's going too high, you
Yeah.
do what you have to do. I was an asthmatic. Let me tell you something. If you need an inhaler,
Yes.
you need an inhaler. That's the way it is. But I think we have been taught that instead of listening to the body to see what's going on, in the old days when you had a fever, they'd wrap you up really warm and give you a little bit of,
Yep.
probably not the best thing, a little bit of alcohol, and that would shoot your fever up, right? Or that's
That's
what they
how I was
believe,
raised. That's exactly
right?
how I was raised. Yeah.
Exactly, right?
100%. Yeah.
So we tend to dismiss that and go, oh no, here's some stuff to bring the fever down. Well, we're not working with our bodies anymore. At some points, we're fighting. So there is absolutely a time and a place for
Yes.
all mainstream medical where thank goodness we have it. But we also, as people and advocates for our own health, need to learn where that balance is.
Correct. I agree with that. Okay. So, what are some common issues that people, and again, you might have mentioned it slightly before, but what trend are you noticing people coming to you with, if any?
Honestly, my entire career, Brenda, the ones that they come to me with are varying because I work in a rural area, so it's sort
Okay.
of like being a GP.
Mhm.
I specialize in women's health, children's health, and actually I've worked a lot with firefighters and police officers, so PTSD has
Oh
been a
wow.
big one.
Hey.
When you go down to the core of where it comes from, though, I really believe stress and anxiety is really the number one. Stress, anxiety, sleep. These are the ones that even if they come to you with tummy troubles or skin issues, or when you go down to the core of what the problem is, generally it's stress, anxiety, and sleep issues. And those have only gotten worse the last few years. People are
Absolutely.
very worried and very, very stressed. And even if they're happy, a lot of people will go, well, I wouldn't say I'm stressed. Well, happiness can be stressful too. If you're moving and planning a wedding, and stress is not always negative. Stress can just be just way too busy, just way too busy. And so it's affecting your health.
I hear all of that. Yeah, stress is not a good thing, and you're absolutely right. I'm saying this to myself right now as we're speaking. Stress is not good.
All
Yes.
people that I know that are high achievers definitely usually sit back and go, yeah, okay, that's probably a little bit relevant. Yeah.
Just yes. And in today's common issues, what kind of questions do you get asked the most? So you're in your clinic, and what are some questions your clients, patients are asking you the most?
Honestly, most of the time, what's the difference between homeopathy and
Oh
naturopathy?
wow.
And then, oh yeah, that's a big one. Most
Oh
people are
wow.
not aware of what homeopathy is, even when they go to see a homeopath.
Hey.
So we get that one quite a lot. And then as it pertains to clinic, we can kind of get into that. But the biggest difference between homeopathic and naturopathic is naturopaths will use supplements to support your body. It's
Yeah.
supplements for things your body isn't doing. This is the simplest answer. It's
Yeah.
much more complicated than that. Um, homeopathy is stimulating your own body to do what it's supposed to do. So it's very different. Naturopaths are brilliant. They take homeopathy, herbalism, nutrition. It's like a GP. They take a lot of
Right.
different things. I specialized in homeopathy for 7 years. I did nothing but learn about the homeopathic remedies, how they're applied to people. So
Mm.
it's a little bit different there. As to how it's going to work within clinic, honestly, a lot of people I think are concerned they're going to be on something for the rest of their lives. This tends to be a trend that I hear a lot. I've been taking either this medication, which I'm never recommending you go off a medication. I just want to be clear on that. But or that, like, how many things can you take for the rest of your life? Like, they get
Yeah.
to a point, it's like, are we going to add a whole bunch more stuff here? This is what I love most about my practice, which makes it very difficult from a business sense, but absolutely phenomenal from a practitioner sense. We don't want you on anything homeopathic the rest of your life.
Yeah.
You have the constitutional, we find it, we get your constitution back up, we know it works. You keep that remedy in your medicine cabinet. If you have a relapse, you go back to it. So there should be a point where your constitution doesn't change that much throughout your life once we
Right.
nail it.
Right.
Patients can come back for acute treatment of a cold or a flu if that needs to happen, but the first thing they should be trying is their constitutional. And so that's the biggest question I get, I think, is how long am I going to have to do this for? It varies. Some people do need to do it a little longer. Some people it's almost immediate, but there is an end in sight. There is a point where you should be able to stop taking the remedy and still have the health benefits that you've had after the treatment.
Okay, great. And it sounds like to also let your body take over from there, kind of, so to
That's right.
yeah.
It's a really not nice analogy, but think about when you're training a pet. Once the pet starts doing what you want them to do, you
Right.
don't keep reinforcing. Now you're going to confuse. So once your body's doing what we want it to do, we try taking the remedy away and adjust things until we have you. My job is done when you're no longer on anything, and then I move on to the next patient. And it's a big wide world. There's lots of patients who need help.
Wonderful, good. So down, so you, again, you kind of mentioned this, which is great. You're kind of giving us all the juice, which is fantastic. But wanted to give you an opportunity again to help people understand what kind of outcomes they can expect when they see someone like you. So they come to you with an issue, you treat them in a full sense. What could they expect to happen over the next 3, 4 months, whatever that timeline is for them?
What you're hoping will happen is the symptoms that are irritating the most will start to come down first, because those
Mm.
are the things that obviously are causing them a lot of discomfort. So hopefully over the course of the first month to 3 months, those should come down dramatically. But in addition, things they hadn't thought of before, perhaps they didn't realize they weren't getting deep into sleep.
Right.
Perhaps they didn't realize their attention wasn't what they thought, it's always been that short. So now all of a sudden that's getting better as well. So in addition to the symptoms you came to the homeopath with to deal with, and absolutely those are top of mind for the homeopath, because obviously that's what's giving you the most discomfort, you should also just generally feel more authentically yourself
Yeah.
and better overall. And there's not, this is why you take such detailed notes as a homeopath when you take that initial, because a lot of times they won't even realize stuff is gone because it really wasn't bothering them before until they didn't have it anymore.
Correct.
So
Yeah.
just on top of your symptoms becoming better, you're also feeling a lot more authentically. You're feeling like your best self, more energized, happier, more focused, more calm, a lot of other things that you wouldn't have even considered something that a couple of little sugar pellets or some, drops under your tongue could do.
I have some of those sugar pellets, and I hear they're quite impactful, but that's just me. So I'll just,
Yeah,
but
yeah.
I hear everything that you're saying there. Wonderful.
Well, and I
Okay,
think, Britta, we got to remember too, not everything works for everybody.
correct.
Nobody's saying that either, right?
Yeah,
So we're not saying that people haven't tried homeopathy but make sure you're going to somebody that really knows what they're doing and they're really taking the time with you, because acute and constitutional homeopathy are two very, very different things.
thank you for saying that. Wonderful. Well, we've learned a lot. We've learned a lot, and I want to thank you for that, for that time that the time that you've used to kind of let us know more about yourself. But I wanted to end off with this question, which I think is important, and I wanted to know if your services or any other homeopaths out there, if you're covered under health benefits. You know, we know that most people have benefits either mostly through their employees, and it's a great resource for you to, you know, make an impact to your wellness. So are homeopaths covered under benefits at all?
So homeopathics can be if it's prescribed by a naturopath. So some people do believe we are. There are very few insurance companies that do.
Mm,
We have a bit of a challenge as homeopaths with that. We're still working on it. We've only been regulated since 2007, which sounds like a long time, but we're a small group. So
yeah,
we are
yeah,
still working on getting that insurance coverage. Insurance coverage requires that you fall into categories for treatment. So if you come to them with a bad back and you go to your chiropractor and let's say it's whiplash. There's
mm,
whiplash treatment A, B, C, D, and we're treating whiplash, and that's what they'll cover under the insurance, and you're all set. So the chiropractor picks the treatment plan that they're going to use,
right,
and then it's approved by your insurance. When homeopaths are not treating a disease but are treating the person, it becomes very hard for us to work within the regulatory for insurance to get into an A, B, C, D category.
right,
So that being said, because we're regulated healthcare practitioners, you can use homeopathic treatment and remedies on your taxes. So
right.
there's one benefit there.
Mhm.
Secondly, I always like to say to my patients that are concerned about the financial impact, yes, it's a little bit upfront. Yes, you have to pay for that little bit upfront, but think about the fact that at some point you're not going to be seeing me anymore, and I'm not putting you on a $300 or $400 a month regime for, I mean, the cost when you look at you're just paying for the appointment and a homeopathic, and maybe some homeopaths will prescribe a supplement here or there to get you through the rough patch, but it's
Right,
much more cost effective when you start looking at insurance companies will cover part of a visit or maybe so many visits, but almost none of your supplementation. It gets to be a little, actually, we tend to come out on the less expensive side very
right,
quickly.
right. Okay, okay. Yeah, I didn't know that. I thought that you guys were covered, but I do know that sometimes people have what you call a spending account.
Hmm.
And again, you know, if anyone's listening to this, confirm with your insurance provider and ask them.
Agreed. I
Um,
always, every patient I have them double check, Brenda, because there are
yes,
rare ones that
yes,
do,
yeah,
if they're more flexible, but for the more categorized ones, yeah, double check before you book the appointment if you're counting on that to cover off, because
yeah,
it varies. It does
yeah.
vary.
Yeah, because we want this to be part of that experience, right?
Absolutely.
Okay, we are at the end. I don't know about you guys, but this was a jam-packed interview. You've given me personally a lot of information that I did not know before, so thank you so much. Again, introducing Christina Barrett. She is a homeopathic, uh, she offers homeopathic, I want to say the word, homeopathic treatment.
You've got it. A registered Ontario homeopath, and so excited to be talking about homeopathy with you today.
Wonderful, thank you. She is the owner at Healing by Caring, again, located near Orangeville, offering virtual consultations as well as in person. Do check her out and give yourself an opportunity to learn more about her. Okay, and with that, we'll say goodbye and thanks everyone for tuning in today. Thank you.
Thank you.